If Chairman Hickman would open us up in prayer.
Number 7. Let us pray. Lord God, even though it's dark outside, Heavenly Father, we know that you're in here with us, Lord, and we know that you're going to provide us with wisdom, justice, and moderation, Lord, as we have this budget hearing. We thank you for that. Lord, we love you and praise you. In your Son's name we pray. Amen.
Thanks, Chairman. We've got sort of a busy schedule today. I think we have about 11 people that are going to testify, so I'm sure being concise will be much appreciated by everybody in the audience. But we also want to hear what you have to say, obviously, or we wouldn't have you here. We're going to just go ahead and get started. Department of Veterans Service, Commissioner Ross, please. Welcome.
Good morning.
Good morning.
Good morning, Chairman Watson, members of the subcommittee. It is my honor to be here in front of you this morning, and I want to express my gratitude not only to Governor Kemp and the House, but to you all for always supporting your unwavering support to our veterans. It is my honor and privilege to lead the team that serves our veterans. I'm just going to cover the changes from the governor's budget to the House, and then what you have in front of you. We are at the end of your tracking sheet, so page 11 and 12. And I'm going to start with...
I think for our committee, I think we're on page 66.
Oh, okay. So on the overall...
Is that's accurate, right?
Okay.
Okay. We got different pages up here, so give us a couple of seconds here. I'm ready.
Okay,
right.
In the overall budget, we're still at the end. Veteran service, you got to go alphabetically. So, of course, we have the standard state additions that go across all the organizations, and I do want to thank you on behalf of our staff for the continued increases in state funding for their salaries. That has made a difference. We, like many other state agencies, have stayed steady at about 40% attrition, so we definitely appreciate the cost of living increases. Looking at our departmental administration, again, we're section 4.8. You can see that originally in the governor's budget, we had done the 1% OPB exercise to take 1% out of our overall budget. That included a reduction in our admin program. The House has added that back in, and let me tell you what that does. Far before my time, that position and those funds were used for things like our annual increases in the software that we use to file claims to the VA. It allows us to do our computer refresh. Any sort of those additions that we get every year, that money allows us to adjust and be able to fund that and to stay in the black financially without having to come back and ask for more funding. So they added that back in, and I appreciate your continued support for that. For the mental health grant, that is being transferred from the cemetery. Last year in the amended FY23, House Bill 414 gave us funding for clinical services for military veterans and their families. And that funding was taken from the cemeteries, which was a state match for a federal VA grant program. Maybe my slides help. So that addition to the admin program, again, we are a pass-through for this grant program. It goes direct to clinical providers. We don't take anything off the top for administration. So that is direct to whomever is competitively selected through the grant process. Our second program is our cemeteries. The only big change that you will see is the reduction of that $1 million that you saw added to our admin program. I'm on page 4 of my slides, if that helps. So that is because the Augusta Cemetery, we've not been successful in our grant for federal funds, the matching VA funds for that cemetery, mainly because the VA has a limited budget and they have put that funding towards expansion of existing cemeteries versus building new ones. So that is the funding that is moving to admin for the mental health grant. On page 5, The House did give us an increase for rising health care cost. That is for both homes. But what has happened over the last decade, we've not had a cost of living increase for those homes. This will allow us not only to keep the same patient census, but actually to increase by a little. I do want to point out what I've asterisked. Those funds are actually because Augusta University manages our home in Augusta, and we have a contractor that manages our home in Milledgeville. So we definitely appreciate the increased cost because that will help us continue to operate our homes, especially as we have to match VA funding, and that funding has gone up every year with a cost of living increase. Last year alone, it was 7.1% they increased, and we do have to have the state match for that in addition to what we bring in patient fees. So moving on to our last program on page 6. As you all know, we as a state are facing significant challenges with our homeless population. About a quarter of those, or 25%, are military veterans. We've been helping homeless veterans kind of in the margins of our time, but we truly need somebody full-time to be able to not only help this population, but to collaborate with other state agencies, with the Veterans Affairs, Department of Veterans Affairs, community partners, and the like, to make sure that we are taking care of those men and women who have served our nation and are no longer unhoused. So the challenge is, of course, that with increased housing prices as well as lack of affordable housing, we need somebody truly dedicated. The House did vary from the governor's recommendation and gave us funding for that. The last line, which was the reduction as part of that 1% budget cut, that exercise, we reduced a vacancy and some training funds to the tune of about $94,000. The House gave that back to us. That was in our appeals division. We had seen a lag because of the focus on legacy or the older appeals through the Department of Veterans Affairs. Those legacy appeals have been exhausted for the state of Georgia, and now we're seeing new appeals, so their workload is going up and in fact is going to be at pre-COVID levels. So we appreciate being able to retain that position to be able to handle that increased workload with the new appeals process. So that is kind of the end of my budget. You'll see on the last page, on page 7 of my slides, it's kind of just the overall puts and takes. Overall, from the states, it's just over $1 million. We've increased to a budget of $29,483,000 and some change. I know that's compared to some of my other agencies, that's not a huge amount, but you see that almost 65% actually comes from the federal government. So that concludes my budget briefing.
Thank you, Commissioner Ross. I have one question,
Yes,
Chairman Hickman.
Yes, ma'am. It's not a question. I'd just like to thank y'all. I periodically will stop in the War Veterans Cemetery in Glenville and talk to people that are visiting their family members or friends out there. And I continue to be just so happy that we're doing that. And it's so well kept and so beautiful. And to talk to family members that are down there and how much they appreciate that, it's a big, big deal. And I thank y'all for doing that.
Yeah, well, thank you, sir. I will make sure to pass that to our outstanding cemetery team.
All right, Chairman Kirkpatrick.
Sorry to be late and miss most of your presentation. I went to the wrong room, but anyway.
Yes,
I
ma'am.
may have missed this, but it's been a few weeks. Can you give us an update on the subacute unit?
Okay, so subacute unit, we did get just over $1 million for the increasing healthcare cost in our homes program. The House has recommended that, and of course we would appreciate y'all continuing with that recommendation when it goes forward. That will not only allow us to keep our patient count, but we're looking at this summer with the new fiscal year actually opening the subacute unit with those funds. So it's exciting to finally get around to that mission.
Thank you, Commissioner Ross. I think that's no more questions. Appreciate your presentation.
Thank you, sir.
We're going to skip down to the Sexual Offender Risk Review Board, Executive Director Tracy Alford. Thank you.
Good
Thanks.
morning.
Good
Thank
morning.
you.
Thanks for being here.
I I'm Tracy Elbord with the Sexual Offender Risk Review Board. I'm the director, and I really appreciate you so much, Senators, for allowing me to speak. This is the first time I've gotten to do this, so I'm really excited. And I know you're really excited about starting your day about sex offenders, right? But I'm hoping to share a little bit with you. We are on Senate line 70.1000, and to share with you, so the Sex Offender Risk Review Board, we determine how dangerous the sex offenders are that are on our registry. And the reason we do that is to provide some guidance for our different agencies on how to monitor them, because we have about 30,000 sex offenders on the registry. And we get about 1,700 new sex offenders on the registry every single year. And we receive about 35 to 65 new out-of-state sex offenders every single month into Georgia. And so Department of Community Supervision and the sex offender registry officers have a huge load on them to monitor these sex offenders. And for SORB, our job is to identify who are the most dangerous so we can allocate our services in the best possible way through community supervision and through the SOR officers and protecting our communities. So right now, the issue for us is that our funding is very small, though we have gotten really fortunate. The governor has provided for 2 additional evaluators. So to give you an idea, we have 3 part-time investigators and 4 full-time evaluators to deal with 30,000 sex offenders. And in our backlog, we have approximately 7,000 sex offenders, meaning they have not been leveled. And we do not have the staff to do that because there's just so many sex offenders that are coming in on the regular. About 10% of those are going to be predators. And about 35% of those are be level 2 sex offenders. So what it means to be a predator means that they're more likely than not to sexually reoffend. And so there's about 700 to be determined predators walking our streets right now that we have not been able to identify. And when that happens, because we have so many sex offenders, then DCS and the SOR officers have to manage them all the same when they haven't been leveled yet. So they don't know the difference between a 1, 2, and a predator, and they want to be very careful, but they only have so much time and money on their ability to do that. So when we can identify the predators, especially those and the 2s, they have the ability to put their resources there. And so imagine about 2,500 level 2s and about 700 predators currently not being classified in our communities. With the governor's recommendation of 2 additional staff, that's extremely helpful. With the House, they have added 3 to that. So that would create 9 total full-time positions for our evaluators. So that would get us where we can classify the number coming in each month. So approximately 132 cases, we get new cases every single month to be leveled. That's a lot of sex offenders coming in. And people don't realize it. I get emails from the public saying, why haven't you leveled someone? They're in my neighborhood and I want to know how dangerous they are. I get emails from victims saying, do you know what he did to me? He's a really bad guy. You need to level him. I got emails from DCS and SOR saying, please level him. We think he's really concerned. He might need an electronic monitor on his ankle. So when they are classified as a dangerous predator, we put a monitor on their ankle. We don't. The state does, and that is able to track them, especially since the level of dangerousness that they present. So with the House's addition, it keeps us with being able to do the ones coming in. However, that 7,000 that's sitting there in backlog, there's nothing we can do about them. We just don't have the staff. We do extensive reports in your binder. On the front page, I just want to give you the basics. I know you don't have a lot of time, so give you exactly what that is. But in your binder, you'll see I give you different reports to give you an idea when you have late time reading that you want to do as to what those look like. They're very extensive, and Georgia does a great job in sex offender management. The legislators have done a great job. The agencies have done a great job. And I get a lot of other states calling me, asking me, how do we do things in Georgia with sex offenders? Because we do such a great job as a whole, as a state. And we're very comprehensive in our report, so it does take time, but it's very good, accurate prediction of recidivism. And so we are asking for the additional funds in order to be able to take care of that backlog in about 6 years. So the additional funds to make sure that we can do that would be about 1.5, and that would make our entire budget a little over 3 million. Currently, our budget is not quite $1 million. Of course, we have the additional, with the House recommendation would be make it 1.5, and so us asking for almost that same amount to take care of that backlog. But once we took care of the backlog, we would be able to reduce those funds. And I think that is it. I appreciate your time.
So you said 1.5 million would make you whole?
That, yes,
Okay. And that would, you would catch up in how long a period of time?
6 years.
We would catch up in 6 years if
Yes.
we put 1.5 in there?
Yes, and then we'd be able to reduce down. We'd be able to reduce our budget by about 1 million after that 6 years once we get all those out of the way. Because again, it's about we have enough funds if we get the House funds to be able to stay where we're at, to be able to keep each month taking care of those 132 cases, and then the additional funds of 1.5 would be for the backlog, which would take about 6 years based on my calculations to be able to finish those.
Any way we can catch up in 3 years?
Double that.
Double down, so 1.5?
Double that.
I mean,
Maybe double that, yeah.
I mean, 3 million instead of 1.5?
Yes.
Okay. Senator Kirkpatrick?
It's really hard to argue with what you're asking for. So my question is, when my kids were at home, there was a service you could sign up for that showed where the sex offenders were that live close by. People that haven't been tiered or leveled wouldn't be on that map, would they?
I don't know, if they tell the name of the offender, you'd be able to look on the registry to see what the tier is or the classification is. If the name's not on there, then you would not know. You're correct.
Yeah, just two quick questions. First of all, to follow up on Senator Kirkpatrick's, what is that website that she's referring to? I was concerned about that. The website she's referring to about you can look in your neighborhood and see if there's any in your neighborhood.
I believe that there's several apps that you can actually get now, and I don't know the exact names. You probably do. I know that Offender Watch is one of them. That's just because I'm familiar with Offender Watch.
Say that again. Federal what?
Offender Watch.
Oh, Offender Watch.
Yes, and they actually have several really good resources in providing information just in general about each state, and then they're pretty on top of it. It's an independent organization that I think is national, and they add all the sex offenders in your neighborhood. Like you said, the only issue is that it's not going to have like different color dots to tell you like is there a predator, which would be great. And actually, since you mentioned that, I love that. I'm going to talk to Offender Watch about the possibility of maybe they can work on that so you know which classification somebody is.
I think it's very important for me to know if somebody like that's living next door to my grandchildren.
Yes.
Or something like that. The second question, are these people employed?
So there is an issue of employment due to proximity rules, and employment's kind of an odd bird with that issue. You have individuals who do not have to comply with proximity based on when they were convicted, and those who do have proximity. And so I actually have a private practice where I work with sex offenders on the weekend, and I would tell you that probably 90% of them are employed. Yes.
All right, I want to follow up next year, okay? So I want to hear some numbers next year.
Okay.
Chair Lady Kirkpatrick?
Yeah, just, I think I signed up through Cobb County. Actually,
through the Cobb
they have a sex offender registry, but I think the GBI has something also.
Well, we do have the GBI registry, which is for the entire state. So you go to the GBI registry site. Every state has a state registry. And then I do believe that most counties do have their own through their sheriff's department where you can kind of log in and get an app that might tell you where the sex offender is living.
And they send you an alert.
Which is even better. Yeah.
Thank you. Any other questions from the committee? Thank you very much for coming today. Appreciate it.
I appreciate it. Thank you.
Commissioner Tanner, you quit sweating. You ready to come? All right.
You have till 400 traffic.
Yeah. Thanks. Appreciate it. I know it's early. Thank you, everybody.
I usually am able to make it by 7 anyway. I left early this morning, but there was a pretty bad wreck below Sandy Springs MARTA station. So thanks for having me. You ready for me? Just jump right in. All right. Well, I was asked by the committee staff to be brief and just to the point this morning, so we're going to do that. So we'll jump right in on slide 2 here. These are some statewide adjustments that you all are familiar with. The governor's recommended budget with a 4% cost of living with a maximum of $3,000. We're excited about that. Obviously, I've told you before during COVID, we lost 51% of our hospital staff. Thanks to you and the governor and the House, we've been able to gain back 51% of those staff as a result of the pay packages that you've approved in the past. But we still have a significant deficit. This 4% will be very much an added bonus for our employees. So thank you for considering that. And then there's some transfers that we've discussed briefly before. Total transfer of the 4.9, just over 4.9 million to adult developmental disability services, which aligns with budget expenditures there. I'm happy to go into additional detail about these statewide adjustments, but you can see the increased funds for the merit system billings and the increased funds for the Georgia Building Authority rental rates to provide for Capitol Police security. Again, you'll see these in all the budgets, nothing unusual in this area. The next item here is a couple of ads by the House. Obviously, you know their budget was voted out of appropriations. I believe it'll be on the House floor today. So this is as it appears in the House tomorrow, and the House budget voted out by the Appropriations Committee. They added $500,000 to increase funds to expand hepatitis C screening services at core behavioral health provider sites. This is Imagine Hope. We have some dollars in our current budget for this, and this was a House ad to an additional $500,000. It's also an additional House ad of $100,000 increased funds for addiction treatment locator, Atlas treatment locator. That was a House ad also. And then on the next slide, the large number there, 9.3, just over $9.3 million. This is annualization of the 500 now comp waivers, which you all approved last year in the budget. You know and have had a lot of information on this. We have 13,339 individuals who are currently being served in Georgia on the now and comp waivers. Those are intellectual developmental disability waivers. We have 7,318 people as of February 1st of this year who are on the planning list. I like to remind people that's not a waiting list. There are people on that list that are waiting on a now comp waiver, but there's 7,318 on the planning list. Some of those individuals are receiving services through other sources like the Department of Education because they're under 18, et cetera. So, and then the next item is the governor's office has asked in his budget for an additional 100 now comp waivers at a cost of $2,345,692. I will tell you internally our department has formed, and Ron Wakefield's led on this, our division director and IDD work group. Senator Chairman Watson's been serving on that, and if he's not been able to attend, he's sent a staff person, and we appreciate that. But that work group is continuing to work through the planning list and really taking a close look at what the ideal number of now comp waivers need to be in the future so that no one's waiting that needs a waiver, waiting on one of those waivers. I will also tell you that one of the things that I've wanted to be very methodical in and very to the point on is very transparent about the number of people rolling off waiver services every year. So with this additional 100 now comp waivers, we anticipate there'll be an additional 400 people who will come off of service. That would be through maybe a death or through moving out of state. So that will actually allow us to enroll 500 new individuals into the now comp program. So that is an important part of this process. I will also thank the governor and thank the House and look forward to thanking you for the implementation of the rate study. That's the $79,901,675. As you know, it's been 20 years or so before we've had a complete increase in all across the board rates for our IDD population. Georgia's way behind in this area. This is going to allow us to be able to get our provider network where it needs to be. This is going to be a game changer for our system, and we're very thankful for this. And I know this has been a long time coming and a lot of work. You all passed some legislation a couple of years ago that requires the state do a rate study every 4 years, which it would be my hope that that will prevent us from getting in this situation where we are so far behind and it has this kind of cost implications. So we're excited for DCH to be able to submit that to CMS soon. The next item is just the federal medical assistant percentage. That's just an adjustment in the federal rate, reimbursement rate. And then increased funds for the Macon Center. You all have heard about that before. You funded this facility a couple of years ago. This is the first of its kind in the country, really in the state, and one of the first in the country. This is going to be specifically designed for those of you who are getting phone calls from CEOs of hospitals about someone who's stuck in an emergency room for way too long, that has an intellectual developmental disability, and there's really no place for that person to go in the state. This is going to be a 16 inpatient bed facility that's going to allow us to move people out of the ERs, out of other crisis centers. And then it's also going to have a very robust outpatient facility. We're working to partner with Mercer on the outpatient facility, which is going to be a teaching facility for new doctors. It's really going to be a place that's going to help us train a staff and a provider network all across the state. The additional dollars here are to annualize and true up the cost of the inpatient, 16-bed inpatient facility, but it's also and the inpatient piece is $1.4 million of that, and the 1.7 of that number is for the outpatient facility. It's important that we not only treat people on the inpatient basis, but we need a place to be able to treat people in integrated health care on an outpatient basis. The other thing this center will have is a very robust telehealth program so that we can help community doctors who are maybe dealing with some difficult cases across Georgia. These will be experts here at this center. They'll be able to help those docs all across Georgia. And the last item there on that screen is a house addition to the Emory Autism Center of $108,000 to increase funds for adult autism services at Emory. Training. Eventually they'll be able to go out and get a job or go to a technical college, come back at night, and eventually they'll work their way out into a community integration home or a forensic apartment, and then they'll eventually be able to be out totally free from supervision. So we're excited about this. I think this will be something that courts will be excited about. They'll give them more of a comfort level, because one of the things you have to remember, some of the people in our state hospitals are there for very serious reasons, and this will be a facility we're going to be able to make real progress with. The next item is the Dodge County Restoration Program. We're thankful for the House for putting some dollars to operationalize that. This was actually brought to our attention by Senator Larry Walker and Representative Danny Mathis. It's a DJJ facility down in Dodge County that they're continuing to maintain, but it's not being utilized, and it's 30 beds. We would contract with the Dodge County Sheriff to operate the security piece of this facility, but we would staff it with our clinical staff from Central State Hospital, and this would instantly give us 30 additional jail-based restoration beds. We have 630 people plus today sitting in a jail waiting to come to one of our state hospitals. This is a huge problem for us. The sheriffs are frustrated. The courts are frustrated. We have got to find a way to increase capacity. I've mentioned this before, and I'll just remind you, we only have 641 inpatient hospital beds for forensics in the entire state of Georgia. Half of those are taken up by individuals who've been there on average of 9 years or more. The other half we use for restoration beds. 630 people waiting to get in, another 1,000 waiting on an evaluation, and about 33% of those will be not competent, so they'll be ordered to the hospital. So we have a lot of people needing to get into a hospital bed We're not going to build a new hospital. We've got to find other alternative ways to increase capacity. This will give us 30 beds at the lowest cost we've been able to find. So I want to thank Senator Walker and Representative Mathis for bringing this idea to us, and we're embracing it. The other item is an additional $1.25 million. We currently have 2 jail-based restoration, well, really 3 jail-based restoration programs. We have one in Fulton. We also have a pilot in Cobb County with 20 beds. This would allow us to instantly increase that to 30. The sheriff in Cobb and the court have been very helpful. And let me remind you, these are not just Cobb inmates. These people come from other counties across Georgia, so it's providing a service statewide. And the third place we're currently doing it is with the sheriff in Chatham County, and we're very thankful for the sheriff there. We have a jail in-reach program and a jail-based restoration program in Chatham, and I think it's working extremely well. So this would allow us to increase capacity by 40 beds at a pretty low cost compared to what we spend in other areas. The next item is, that's just for, the governor had asked us for a 1% cut when we were doing the budget, so this has reduced core funding by just over $11 million. I will tell you, this will not decrease our level of services during COVID, because we not only had a problem with employees, but our providers, our CSBs also did. So they've just been able to provide less service. We feel comfortable with this cut. Obviously, as the ability to hire and to increase the level of service increases in the future, this will be something we'll have to revisit. But at this time, we feel comfortable with the cut proposed by the governor. Next item is, you've heard me talk about, we did a bed study that shows we need 8 additional crisis centers in the next 10 years in the state, and it shows where those need to be located. This would be to fund one of those crisis centers. We also have a crisis center currently under construction that you funded last year in here in Fulton County. The 3.7 would annualize that. The House added the additional dollars because Fulton has an increased, enhanced staffing level because of the busyness of their facility that was originally proposed in their recommendation. So the House added those dollars in, and that's reflected in your budget from the House. And the other 2 items there is, we also are building new or replacing facilities down in Dublin and one at Serenity and Augusta, and that's just to annualize that cost. And that was in the governor's budget and in the House budget. And then there was an $825,000 add in the FY25's budget for homelessness, and that's just to eliminate that one-time add. Next item there, you see the federal medical assistant percentage. That's just a true up of that number. And then the community behavioral health rehabilitation provider. This is the rate study from the behavioral health side. We just talked about the one on the IDD side. The behavioral health side's also behind. The difference between the governor's proposed number and the House is just simply a correction. Those dollars was incorrectly put over into DCH's budget, and this was just the House correcting that. So no additional dollars overall from the House and the governor. It's just a move from the DCH budget to our budget, and that's something that both DCH and our agency supports and have talked to the governor's office about. Increasing the 988 hotline. We have $1 million grant from SAMHSA that's going to be expiring in the next fiscal year, and it pays for several employees, 16 employees, and this add of the $300,000 would allow us to retain 4.8 of the 16 employees, and we're thankful for that. We've made great strides in 988, reducing the call time down from 200 seconds to around 10 seconds to answer the call. We're receiving on average 20,000 calls per month. And as we continue to expand the knowledge base of 988 as we're doing marketing, we expect that to increase. The House added $2.5 million for an increase to the Georgia Housing Voucher Program. We have saw a tremendous increase in this program. This is part of the Department of Justice settlement agreement requirements that the state agreed to. We have increased. We now have We have over 2,500 individuals receiving a Georgia housing voucher currently. One of the challenges we faced is rent prices, as you know, have went up tremendously, which is something that we felt. We have saw rental rates increase 19.3% during FY 2023, rising from $761 to $908 on average. And the average monthly subsidy also rose 9.8%. So it's been, we've had to try to, not only is the program increasing, the number of participants increasing, but we also are seeing the cost increase to pay rent. One of the things I will tell you, if you really look at the numbers that's come out over the last few months, it actually will show you that we have a deficit of around $20 million in this program. So we're thankful the House is adding $2.5 million. We would ask you to continue to work with us to look at those numbers. But I will tell you what we're doing internally to control that cost is we've been working closely with Commissioner Nunn at DCA. We're going to be able to move some people over to the Choice Voucher, which is a federally funded HUD voucher program. And we have 1,000 individuals currently who receive the Georgia Housing Voucher who have been receiving it for over 36 months. We're analyzing currently who of those 1,000 individuals are stable. My goal is for our departments to move 700 individuals over the next 12 months to the Choice Voucher program, which will take them off the state payroll when it comes to the grant or to the housing rent subsidy. I will tell you we'll continue to provide wraparound services for those individuals to make sure they remain stable. And over time, long term, our goal is to bring people into the Georgia Housing Voucher, stabilize them, move them to the Choice Voucher, make sure they have the wraparound services, and eventually do a warm handoff when they're stable on the Choice Voucher over to the community service boards. That's going to be a way that we can reduce this cost and control this cost long term, but also continue to provide the much needed housing for individuals. We're also going to continue to track the individuals even when they're on the Choice Voucher, not only for the Department of Justice purposes, but also for our own purposes to make sure that no one's falling through the cracks. So we're gonna be able to reduce that cost, or at least bring that cost in, so we'll have dollars available when people are needing the voucher. Other areas there, the increased funds for behavioral health services for Georgians experiencing homeless in the Atlanta area. That's a house ad. That's to Mercy Care here in Atlanta, who does a lot of work with the homeless population in Atlanta. And then the other item is also a house ad of $200,000 to increase funds for behavioral health care services at a rehousing facility. This is at the Melody in Atlanta. A lot of you may be familiar with that. It's really the first of its kind, where they took the GEMA trailers, the GEMA buildings, and created a community to take people off the street. A lot of these individuals need wraparound mental health services. Fulton County, who is our mental health provider inside Fulton County in Atlanta, they're providing a lot of these services, and this is a house ad to add some additional resources for that purpose. Next item is increased funds to expand enrichment, employment opportunities for children and young adults with developmental disabilities. This is an extra special people program. This was a house ad. The University of Georgia. This is a great program. They have multiple locations. If you're not familiar with it, I encourage you to visit with them. My daughter's actually a senior at Georgia, and she's been volunteering the last 4 years with this program, and it's a great program. So the House is very familiar with this, very close to this program, and they added $300,000. And then there's a $200,000 House ad to provide funds for autism early screening and care in rural communities. This is a pilot program between Emory, Mercer, and the Marcus Autism Center here in Atlanta. So a lot of good agencies involved in coming together to do this study. And then child and adolescent changes, the $600,000 decrease. That is the PRTF. If you recall, there was an ad in the budget to be able to increase their reimbursement rates. That's been taken care of through DCH and DHS. So that's not that we're not decreasing their reimbursement. It's just that's no longer needed in our budget. The other item that we've talked about is increased funds for the operation of the new Gateway Child and Adolescent Crisis Unit. this is partial funding for a partial quarter for this to open in FY25. The House and the Senate added dollars in to construct that facility in your amended budget that has been approved and signed by the governor, so that design and construction will start. We're excited about this program, excited about this facility in Savannah. And then the House also added funds to increase Apex by $2 million. We have 735 schools currently that we're funding an Apex. This is a licensed clinician, mental health clinician in the school. We have 48% of those schools are rural, 52% are urban. We received 22,000 referrals were made from school-based mental health services. Over 4,500 students received first-time services, and we had almost 16,000 unique students served, and then we had 35,544 telemedicine services provided through this program, and the House has added $2 million to expand the number of schools that could receive that program. And then the last item there is the reduced funds to reflect technology savings. Again, this was something that was done at the request to cut 1%. Brandon Kinney, our Assistant Commissioner of Operations, and Jason McSwain, our IT Director, has done a good job of identifying savings in our IT department, and they felt comfortable with this cut. So we offered that up to the governor and offer it up to you. With that, Mr. Chairman, I think that's a quick overview of what the governor's included in his budget and also all the House additions, and I'd be glad to answer any questions.
I have just a couple clarifications, if you don't mind.
Yes,
the
sir.
988 hotline, how many did you say employees are there now?
There's 16 employees paid for by the grant that's going to be expiring, and this would cover approximately 4.8 of those.
And the time on that, I think you said?
The grant ends later this year, so this would be we would be having to either find a way to try to supplement their funds to continue to keep those employees, or those would be positions we would lose in FY25.
The time on answering the phone?
Oh, it went from 200 seconds down to around 10 seconds on average.
And thank you. Tell me about the Gateway Child and Adolescent Crisis Stabilization Unit, Savannah. When is that? If we just put it in the budget to design and build it, when do they break ground and when do they finish? About
our hope is we would be able to have the facility open by the fourth quarter of FY25. So these dollars would be for that purpose, for the operational cost. We're fully, between the commitment that Chatham County's made, the commitment that we've already been able to fund through our budget, plus the dollars added by the Senate and the House, the construction is fully funded.
Okay, maybe we can just talk about that offline, just
Yes.
dates on that. Thank you. Chairman Hickman.
Thank you, Mr. Commissioner. Just a comment. We were very fortunate in the Senate to pass a bill. I forget the bill number, but it was GAIN bill. Georgia is a model employer for hiring people with physical and mental disabilities, and it passed with no opposition. And we will present that bill to Chairman Werkheiser's committee today. And so what this does, as I understand, we probably have 150,000 people in Georgia that have disabilities that could be working, and we've only got about 30,000 working. So this will make Georgia a model state to hire people with disabilities. And thank you for helping us and supporting us on that bill.
Yeah, that's great. Thank you. And we have a lot of supportive employment work through our agency along with Georgia Vocational, and we appreciate that work, appreciate the focus the Senate had on that.
Thank you, Chairman. I don't see any other questions. I'm sorry. We do.
Commissioner,
All right.
on 15.57, the addition that the House did to enhance the staffing levels at the Fulton County Behavioral Health Crisis Center, does that fill the bill? It's a matter of holding it in the Senate, or?
No, it that's 100% of the needed cost. Yes, ma'am.
Thank you so
Yes,
much.
ma'am.
Any other questions? Thank you, Commissioner Tanner. Appreciate you being here.
Thank you very much.
DCH, Department of Community Health, Commissioner Carlson.
you. Thank you. Good morning, Mr. Chairman, members of the committee, and Senate Budget staff. Thank you for the time today. I'll be working from the presentation I think you all have, and it is on the screen, but it does correspond with the proper tracking numbers. So, however, whichever method you choose, I think we'll be on the same page. But I'll try to follow the Senate budget, Mr. Chairman's instructions request to spend the bulk of my time speaking to our underlying requests, but also those changes that are a little bit more programmatic in nature. We have outlined a lot of the House changes in your packets, and I can spend as much or as little time as you like on those. But I'll reference those, but obviously I'm not trying to gloss over them either. I know each constituency and stakeholder, it means a lot to them, and I have the respect for time. I'll just allude to them and spend more of our time talking about those broader changes that affect the entire programs. But again, as you may have recall in joint budget and amended, I try to at least kind of start out with just some kind of reframing of everything. Obviously, much of what you see in here, budget projections, programs, priorities, are by and large set in motion by the end of the public health emergency, which required us to reevaluate, redetermine every Medicaid member across the country, 56 states and territories. That's an ongoing exercise that the 14 months mandated to us by the federal government would set to end May 30th, and there will obviously be a lag as as individuals due process, appeals, rights, and not to mention just due to stress in the system, there's a bit of a backlog, as you would imagine, with all these endeavors happening at once. But May 30th, people will be getting their notices throughout March to set their process on their anniversary date, if you will, their redetermination date. But again, there is a lag, as you'd imagine. So as far as your packet moving into the FY25, as far as our slides, I will move to slide 8 in our presentation, which is just kind of the programmatic kind of outline, and then we'll begin working through tracking numbers. But what's interesting is everything we talk about today is a lot of movement and reprioritization within Medicaid, because as you can see at the bottom right of this slide, slide 8, the only difference between the governor's rec and some of the House changes is a little over $2.5 million in state funds. But obviously a lot of those reprioritizations set different programs and initiatives in order. But again, a lot of that is tied to redeterminations and projections changing from when we began the budget process, as you'd imagine, with OPB and others in the fall, September, and then with redeterminations be a month-over-month exercise. That is something that's in flux, and several of these changes are due to updated projections. All right, statewide changes, which again, we're not going to spend a lot of time on, but just like any commissioner that will be here today, I can't thank you enough, the governor, the House, and the Senate for your support of all the cost of living adjustments and just attention to our state workforce. It means a lot. As I always point out, a third of our agency is retirement eligible in the next 2 to 5 years. And within DCH, Medicaid, the division itself, is closer to 45% retirement eligible in the next 2 to 5 years. But I am happy to report that the staffing focus for both Medicaid and HFRD, which are our inspectors, the people in the field. I look at Medicaid and HFRD as really kind of the foundation of the agency as far as serving stakeholders. Those two staffing levels for those divisions have not been higher since before the pandemic. It's very intentional, and I can't thank those divisions enough. Again, moving through the tracking sheet, we've highlighted changes, as you can see in the bottom right corner with 7.1.10, a House change, but again, not necessarily speaking to all these. There's one that I'll point out, and we'll speak to it in an upcoming slide. 17.1.7 is a request that we had of OPB, and it was in the governor's rec, and the House has held it, and we'd humbly ask for your attention to it. It's 20 positions to better, we'll go right to it, slide 11, to better monitor with the new CMO contracts before us in the months ahead. DCH fully acknowledges that something that the department's been asked to focus on in the past years is how do we better have control of the data? How do we better monitor quality? How do we, DCH, know the answer to more questions ourselves internally, have autonomy over that data, rather than being reliant on all these vendors for show me what you're seeing? We know that we need to do a better job of contract compliance and real-time analytics, and what's presented for you on slide 11 with this budget request is us investing in the systems and the people to be a better steward of those Medicaid dollars as it pertains to the future of CMO performance management. Like I've said before, when I look at these RFPs that are on the street today, yes, we're asking a lot more of our CMO partners, whether it's quality, and prompt payment type things. But when I look at them, I think of all the things we're asking DCH to do better. And this is a representation of those priorities to do a better job of monitoring these contracts. It's the state's largest procurement, and we're trying to be tight in how we manage these and get better quality outcomes with these vendors and these partners of ours throughout the state. Moving to our slide 12, several of the other changes that you've seen across budgets. I will allude to, again, 17.2.5 is a change with the House. A lot of this is investigative software, one-time startups, and annual costs across the Board of Dentistry and the Board of Pharmacy. Moving to our slide 13, healthcare access and improvement. A lot of these programs, again, are important to you when it comes to GME programs, the rural stabilization grants. I'm proud to announce that things are going out on schedule. Awards have been coming out on schedule. In some instances, we had a combined 39 applicants for some of these programs for what ultimately amounted to 5 to 10 awards. It's the most robust participation from hospitals that we've had in many of these grants. So we're obviously appreciative of the attention, and obviously the fact that many more hospitals are seeing the value and going through these grant proposals and competitions, and we're grateful for their participation. But yet there you'll see several House changes that one of note is 17.4.3. Last year there was $4 million in one-time funding for several of these GME programs, and we got those out the door. That's why you saw the governor's reduction. Those are one-time funds that have been executed. The House seems to have an interest and a willingness to put in $2 million for two $1 million awards into a base budget and for an ongoing competitive process there. That's what that movement represents. And then 17.4.10, you'll see that they have put money back in for the rural hospital stabilization grants, which I know mean so much for you. There was a decrease in last year's budget, and this is putting funds back in. I believe it was reduced by $5 million last year, and they're putting back some funds towards those. But again, several of these House ads most certainly have merit, and we're available to discuss individually or in the questions following today. HFRD, which I allude to, the surveyors and inspectors, really the backbone of how we interact with stakeholders. 17.5, 1 and 2. going towards improving that workforce. As you would imagine, it's a lot of churn. It's a lot of people living out of their car, so to speak, going into these facilities for multi-day surveyors. So when the governor, our slide 15, when the governor and OPB asked us to consider what we would do with additional funds alongside the CMO performance management data analytics that you saw earlier, our second request was to shore up the HFRD inspector surveyor workforce using Louisiana's average salary as a comp. We have a target and a strategy to get these guys to a place that shores up our workforce. As you guys know, of everything we do, delays and backlogs and surveyors will get CMS's attention along with fines and along with scrutiny faster than anything. So a prompt survey process and staff is of paramount import to not only ourselves as stewards of the dollars, but also as our stakeholders who are awaiting a survey, who need these things to get done in a prompt manner and aren't in holding patterns into perpetuity. All right, moving in to ABD, which, as you saw from the first programmatic slide, did have some movement as far as reductions, a $21.6 million decrease. Again, that's based on utilization with redeterminations and enrollment projections that were originally, with the governor's proposal, September enrollment projections. What you see now are more of December, January enrollment projections that we've tried to do in concert with House budget, Senate budget, OPB, just letting everyone know what we're seeing in the field and how to budget appropriately, knowing that there's still a lot of time. When you take in the lag on appeals, excuse me, the redetermination process could very well be going into the late fall. That's a conservative estimate. So any snapshot in time would give you a different number depending on how the pending cases are going, appeals are being adjudicated. But I am proud to say that the redetermination process has improved month over month. One, ourselves with Commissioner Brose and her DFACS team and CMS, we're all getting a little bit better at doing this. It is a once-in-a-lifetime exercise for a reason, post-PHE. Secondly, our systems and technology have improved. I know the ex parte process, the automated on the front end process, is something that has been important to you all along. When you take in the SNAP and TANF cases alongside the Meta cases, of which a DFACS worker, caseworker does all those, our ex parte rates hover between 50 and 60% now, whereas when we started this, it was in the 28, 29%. So the more we can do in an automated fashion on the front end is less impact to that family not really understanding their status, knowing their status, being held in limbo. So it's something that's improved, and I can't thank both of our teams, both DFACS and DCH teams, as we work through that and are honest with one another and make changes to systems and processes when we need to. And obviously, we want to especially thank OPB, who made ARPA funds available in December for surge capacity, in other words, caseworker augmentation from both a human resources perspective, bodies, but also process automation improvements that'll help us work through that backlog faster. That backlog, working through that, is what I see as the tide that lifts all boats. It gets through cases faster. It gives you a better budget snapshot, projection-wise, and obviously it lets the families know of their status. Back to the tracking sheet with ABD, there's a lot of movement in 17.71 through 17.76. That's really one big exercise in reconciliation. You have projection changes. You have the winding down of that enhanced FMAP through the PHE. You also have the fact that our traditional FMAP changed, Georgia's FMAP calculation changed due to population and economic factors. Then you also had the fact that unlike past years, this past amended budget is when we funded, you guys funded the nursing home cost report changes. So within ABD. So you have, and then obviously in the FY25, there's a proposal to move to a more updated cost report for nursing homes. So you have a lot of movement through all of these different programs, which again, at the end of the day, eventually amounts to a net of $2.5 million. But within ABD, I think it was roughly a $28 million difference through all these different movements, of which there are many. $21.6 million, billion dollar decrease in ABD. Again, all of these programs have merit, and we're happy to discuss them all. But per the request of Senate budget and the chair, these are the changes the House made. A lot of different programs with clinical value. Obviously, Commissioner Tanner alluded to 17.7.12, the now and comp waivers related to the rate studies that's been ongoing. As Commissioner Tanner alluded to, DCH is moving forward. Those will be on our DCH board agenda next week, next Thursday, the 14th, where they will be going to CMS for ultimate approval. I do want to be clear, we're not getting in front of the appropriations process, the legislative process. We can always, in the event there's a change here with the Appropriations Act, we can amend what we're submitting to CMS, but I don't think it was is your intent for us to be waiting on that. So we're going to get it up to CMS and begin advocating for that passage. But all these programs, the GAP program, long-acting injectables, speech pathology, audiology, PT, OTP. There's obviously a lot of discussion. One thing I'd like to point out on 17.7.16 is we've had a lot of discussion in the past couple of weeks over independent pharmacies, dispensing fees, PBMs, things of that nature. There have been changes to dispensing fees over the years, and this represents the House's intent to do so with lower volume pharmacies. One thing just I'd like to point out is a lot of the discussion in the last couple of weeks prior to crossover was over legislation that spoke to independent pharmacies and reimbursement as it pertains to SHBP, your state health benefit plan. This line item is in Medicaid, so this represents the House's intent to address some of these issues in the Medicaid budget, but a bill will be coming your way through the process, according to however the Senate would like to address and when, that will be specific to SHBP. So I just kind of wanted to point out some of the difference in several conversations going at once, and just wanted to just make sure I was clear on the differences in this budget line item in the legislation. Several code changes and requested increases. This kind of quantifies in the dollar cents of much of what Commissioner Tanner presented and also spoke to. These are the dollar figures associated with those rate studies on our slide 18. And again, these will be represented in the items that will be going forward to CMS at our DCH board meeting next week. Again, a lot of synergy and choreography between DCH, DBHCD, and OPB as we all kind of try to understand the rate studies and what should move forward and when. And again, I always kind of say this is as much for my benefit as yours, but as a takeaway, here's our slide 19 goes to several different waiver programs and the nuances between them because there are many. Slide 20, as we move into low-income Medicaid, again, LIM is the biggest as far as member category. So when you talk about redeterminations and changes in projections, those are the largest numbers and the largest areas of movement. Several things you've seen before. Again, the winding down of the enhanced FMAP along with Georgia's FMAP changing. And again, several changes that you just saw in ABD as far as House changes for specific initiatives are represented here, just again mirroring that with the low-income Medicaid population. Our slide 21, beginning with 17.8.9. Again, several policy initiatives that the House enacted for different constituencies and program changes, represented here before you now. Many again mirrored from ABD to LIM. And then there's an interesting comment I'd like to make on slide 22, 17.9.1. Peach Care, SRS chip program. Actually, there's an increase in utilization there, and really that's a new policy that CMS instituted through the Senate, through Congress's Appropriations Act in the spring. It's 12 months of continuous enrollment for children. And what that means is when someone comes on Medicaid through the Peach Care program or as a child, their circumstances, they'll be reevaluated on their anniversary date, July 1 of 24 to July 1 of 25. Even if their family's circumstances change, household income, household size, all those different. So even if a data set or a touch point suggested that family's circumstances might have changed, that child, if they are deemed eligible for Medicaid, they have 12 months, again, little definition, of continuous eligibility. And what that is for children of that age, as they're getting different screenings and different clinical initiatives, there's not much of a flexibility in that child's life. They have 12 months of continuous enrollment. Should they not be eligible on next year's anniversary date, then they will not be eligible. But there's not necessarily a month-to-month dynamic of will they be in or out. So what you have is that stability does have more people staying put in Peach Care, if that makes sense. So utilization in Peach Care is a little bit higher, but it's usually kind of evens out in the sense that those people will be coming on and off LIM and different programs. But Peach Care itself has held a higher number because those children are staying put. And again, just several items that were not changed. And I'll close with the point on the SHBP, and we can't thank the legislature and the OPB and the governor enough. Due to all the dynamics that are true for Medicaid or anywhere else, or public-private carriers are true with SHBP, that utilization, costs, inflation, the fact that for several years we did not change premiums. This is slide 24 represents the current trajectory of SHBP expenses and revenues. And I'd point your attention to your far right there, FY25 projections as stands would have the expenses and revenues getting out of line for certified educators. As you know, there's active members, state employees, retirees, and then a robust educator community within SHBP. So you see some trajectories getting out of whack as is, but thanks to the governor's recommendation and the House has held this, there are changes to SHBP and how the certified school employees are paying into that program that get those revenues and expenses back in line and helps the program as far as solvency moving forward. And we, as far as members, asked for a modest premium increase this past summer. So we're trying to ask all components of the SHBP program to help us keep up in these dynamic times. So I know that went a little bit longer, but like we say at the office, I know it was a lot, but that's only because it's a lot. So, and I always close with the ongoing systems changes, the behind the curtain.
A little
things
complicated. We
so.
appreciate that. I have a question, Chairman Hickman.
Yeah, thank you, Mr. Commissioner. You know, you and I've got a long background of nursing homes. And so we've been working really hard with the school systems, and we know there's a grading system for schools, A, B, C, D, or F. Is there a grading system for nursing homes?
Yes, CMS has a 5-star program that I know several times in past appropriation cycles. I know Dr. Burke would occasionally do this, where we've kind of, as far as a quality initiative, kind of pointed to 5-star ratings. I think any provider across the country will tell you that 5-star rating is not perfect, but it's the system that's in place now. I do know that Georgia, though, with Senator Burke at the time, and the Senate really led on this, developed some quality incentives. There's 4 metrics now and an ongoing analysis of nursing homes that roughly state and federal funds is about $36 million worth of quality incentives that's set to go out the next tranche in June. Those metrics, though, pressure ulcers, antipsychotics, urinary tract, there's a couple. The metrics are due to change, and I think providers would like to see them change too. We would too. The one interesting dynamic with that is obviously any changes to our quality program has to go before CMS. And as you know, CMS has a pending rule now that mandates new staffing ratios for nursing homes across the board. Pretty aggressive. As you talk about workforce through this building, it's pretty aggressive. So to send up the changes that we'd like to see, and I think providers like to see, is awarding staffing, but with CMS having that pending rule there that completely changes staffing across the board, we're not changing the metrics just yet until we know how that's going to be resolved. But to get back to it, there's a 5-star rating at CMS, and Georgia has in the past, again, especially the Senate, led on quality incentives that is still in place in our base budget, which amounts to about $36 million. That again is set to go out in June.
So can you help me find that rating system?
Yes, sir.
Okay, thank you, sir.
Yes, sir.
Commissioner, just redeterminations, been a big issue. Can you sort of help us understand how we're going to sort of address that and plans related to that?
Yes, sir. No, I appreciate it. It's been the center point of pretty much everything we do. We are, I guess it's safe to say that the end's in sight in that, in the sense that the 14 months that the federal government gave us to do this when they mandated last spring would be set to end, the end of May. But that being said, there is a substantial backlog of cases just due to the convergence of everything. All this lands on the same DFACS caseworker's desk, so to speak. So that's why OPB helping us with that staff augmentation was so important. So there's a significant backlog right now, and then you have the window of where people are still in their appellate window. So I think it could be on into the fall before some of those matters are reconciled. And then you have, depending on which metric on any given day, you have roughly 100,000 new applications, right? So while we're going through redetermination, the world's still spinning around. You still have new applicants into the Medicaid system. So you're trying to help the new applicants. At the same time, you're trying to adjudicate those going through redetermination. So we're hoping to have a lot of this reconciled throughout the fall.
Thank you.
Yes, sir.
The other Senator Watson.
Thank you, Mr. Chairman. I know that, and I've heard all these rate studies were completed, and I've heard that mentioned a couple different times. But the GAP program, I see the House has added some funds there. Is that enough to bring parity with the other waiver programs, or why were they not included in the rate study surveys?
Yes. So when we prioritize the rate study, we did so with those rate studies that were appropriated in past years, and that's why now comp and the others were already conducted. But what we did, though, so we're not caught flat-footed, is we worked with our existing vendors to do a study internally with what the GAP program would need to have that equity. It's based on the numbers that we pulled together and responded to budget offices with. I believe the House funding represents probably half of the target.
Okay, thank you.
Yes, sir.
All right, I don't see any other questions. We do have a late arriving one.
Thank you, Mr. Chairman. Thank you, Commissioner. On the state health benefit plan, increasing the per month per member premium cost, what's the gap? What's the difference between, in other words, what is the dollar increase per month? That's on slide 25, I think.
Yes, ma'am. Too many documents. I believe that number is, let's see here.
It's 1760 is what it's going to be increased to.
Right.
And from what prior number? What's the?
Yes, ma'am. I might have to get back to you on that. To make it especially interesting, educators and actives are funded differently. I believe this is probably the best. So I believe what is it?
1580.
15.
Yeah, 1580 is what
1580 would be for now. Yes, FY24 would be 1580. But there is a step increase over the subsequent years, 25, 26, 27.
Thank you.
All right,
For certified Senator.
Yep.
Certified
got that, Senator.
teachers.
All right. All right, thank you, Commissioner Carlson, and appreciate your presentation.
Thank you.
Georgia Composite Medical Board Executive Director Jason Jones, who has been on the job now for almost a month.
Feels like 5 years.
I'm sure, yes. All righty, I think we have a handout here for the committee. All right.
Yes, sir. So just for time's sake, I have a handout. I don't think I'm going to do the PowerPoint unless y'all just need me to. Okay. Thank y'all for having me, and I appreciate everybody listening.
If you could get that mic maybe a little bit closer to you.
Sorry.
There you go.
Is that good?
No, yes, certainly.
So I appreciate y'all having me here, and the conversations we've had. Appreciate those too. But so to get started, let's see. I'm kind of midway into the budget period when I started, so there wasn't a whole lot I could provide during that time. So, sorry. So our budget fiscal year 24 was $3,151,410. That's on slide 7. So during that fiscal year, we also collected $7,500,000 and some change in licensing fees. So page 8 kind of gives you a breakdown of the licenses that we processed during that time. So there'd be about 60 some odd thousand licensees that we have that we regulate and license through the state, from physicians to physician's assistants and other licensees. So our budget that was requested and given was $3,151,410, with total public funds of $3,451,410. So in those, we have the 4% cost of living adjustment for state employees, which our employees do appreciate that, and thank you for for giving us that, and the governor's office for extending that to us, because we do have some that are under 40,000 a year, which is hard to live off of. So we're trying to raise that as well within the next year or so. So this is on page 9. So 100.1 is that increase, and then 100.2 is DOAS insurance programs increase. 100.3 is increased funds for merit system assessment billings. 100.4 is an increase in funds to provide the 3,000 targeted salary for the post-certified officers that we do have, which we have 7, so they appreciate that tremendously. I think they missed out on some before because it wasn't requested, but I'm thankful we requested it this time and got it for them. Thank you for that. And then the 100.5 is utilizing existing funds to replace 3 vehicles. We have a aging fleet of vehicles that cost more to keep on the road than it would be to probably purchase new vehicles, so we'll get that done for them. And then 100.6, utilize existing funds for a customer service specialist. As most of you know, that's one of our problems is our customer service, and making sure that we respond timely to licensees and their requests, and trying to get the licenses adjudicated as quickly as possible. So that'll help us with triaging some of the customer service issues that we are experiencing. We also just hired an additional one that was a vacancy for customer service, so we're getting that kind of squared away the best we can. So the total appropriations is at 100.1,000, so it shows all those that we just discussed, and the total public funds of $3,582,148. So with me just taking this position, assessing everything, it took a little time to figure out the issues and what needs to be fixed. So with that, we did do an addendum to the governor's office and OPB for additional funding for a new database system, because right now our database system is kind of obsolete and isn't user-friendly and doesn't have a workflow to it. So I won't bore you with the details, but it's just not where it should be. So we are researching other vendors. Spoke with 2 already, and their systems are very user-friendly, and will be able to talk back and forth to the licensee so that they know where they're at. And our system now cannot. So it'll be a better user-friendly dashboard system that can talk back and forth and make sure licensee knows where they're at, and our staff knows where they're at, because right now they have to email the staff in order for them to look up in our system, and those emails get lost in the sauce. So we're working on that, trying to get that additional funding so that I can get that, as well as ask for 3 additional enforcement specialists, 1 criminal investigator, finance manager, a media specialist, and 3 senior managers in that request. That's to help with the span of control over each division, because right now there is none, and everybody's working the same load as everybody else. So I believe that will help in alleviating the issues that we've had in the past. We just need to get there. So on slide 11, this is kind of the outlook for 2024 and 2025 from my assessment. So finalizing implementation of data collection under House Bill 1013. We're gonna work on that and get that accomplished. So we did add the residency training permits and APR and protocol applications to our current online portal, so it's no longer paper that can get lost or misplaced, or it's all electronic now. So we should speed that along a little more. So we're also going to require upload of all supporting documentations at the time of application submission, so that these items aren't lost, and it's up to the applicant to have everything ahead of time, so they're not bits and pieces and things together. because on the back end, we have to confirm a lot of this stuff and make sure that it's accurate and true, so that takes some time. And again, update the database software to provide a more cohesive workflow amongst all divisions and licensees, and then continue to implement all remaining recommendations from the 2020 DOAA audit. So that's where we're at. I've identified a lot of the issues that we have, and hopefully can move forward and get things accomplished.
Thank you, Director Jones. Appreciate that.
Yes, sir.
Is the on 100.6 is that going to be enough to hire a full-time employee for the customer service specialist?
So, yes, that's the salary. That's what Also, in my addendum, I'm also adding extra funds to add to that so that they're over 40,000.
Okay. All right. So, and that's can you just give us an update on the governor's proposal as that goes along, and appreciate that.
Yes, sir.
Okay. Any questions from the committee? All right. Thank you, Director. Appreciate you being on the job.
Yes, sir.
Okay.
Thank you.
Next is Georgia Drugs and Narcotics Senior Manager of Business Operations, Carla Leary. Good morning.
Good morning. As you said, my name is Carla Leary. I'm the Senior Business Manager for Georgia Drugs and Narcotics. I want to apologize for Dennis Troughton not being able to be here today. He had to be in the Pharmacy Board meeting that's being held today in Savannah, Georgia. So thank you for allowing me to be here today. Our mission is to protect the health, safety, and welfare of the general public by providing an enforcement presence to oversee all laws and regulations pertaining to controlled substance and dangerous drugs. I would like to thank the governor, the legislators, and everyone for the potential cost of living adjustments for our employees, as well as the enhancements for the certified post officers. Right now, we have 14 of our 19 employees that are post-certified. The two items that I would like to discuss is the 101.6, the increase to reflect the full cost of the database management agreement, and as well as the 101.7, the increase for tablets to enhance the inspections and investigation process for the agencies. Currently, we are using laptops, so we're a little bit behind the scenes. So this would actually help the agents become more efficient and not be able to carry such a lot of equipment into the pharmacies. This is pretty much the two items that we would like to ask for in addition. I'm available for questions if you have any for me.
Thank you. Any questions at all? Just an update, timeline, implementation of your database, employee onboarding.
Absolutely. We have the employee already in place. We hired her in October of last year, October 23. She's actually sitting in on the calls with us. We're in the information gathering phase of customizing the database to fit our needs. We meet bi-weekly now, and we're thinking that at the rate that we're going, we'll be able to be up and running fully by the third quarter of FY25.
Thank you, Ms. Leary. Appreciate it.
Thank you for your opportunity.
Yes.
You have a great day.
All right. Department of Human Services, Commissioner Brose. No. All right. We got a substitute here, too. Substitute. All righty.
Good morning, Chairman Watson and members of the subcommittee. I am Demetrius Taylor. I serve as the Deputy Commissioner of Finance for the agency, and with me here I have Melissa Barrett, who is the Assistant Deputy Commissioner of Finance, and she focuses strictly on DFATs and is the DFAT CFO. So you have the PowerPoint slide in front of you. I have roughly 24 budgeted line items. I can go line by line, or if you prefer for me just to kind of cover highlights and the House recommendations. Okay. Moving to just on slide 2, just want to highlight we have total state funds adjustments of sure everybody got one. Good, okay. We have total adjustments of $40.5 million in additional state funding. I would like to thank the governor for his recommendations, as well as the General Assembly for the 4% cost of living adjustments for our state employees. Turning to slide 3. On the second line item, you see an increase of funds to provide $3,000 additional salary enhancements for our child support workers. The House recommended an increase of $1.1 million. That impacts roughly 700 of our child support agents. And so their entry-level salary is $34,000, so that would take them to $37,000. And at this supervisory entry level, the starting entry salary is $47,000, and that would take them to $50,000. The next House addition you see here is to increase funds for our prosecuting attorneys council contract that we have in Georgia. Is also known as PAC. And this is to fund or to provide funding for 11 of our attorneys that provide legal representation to the enforcement and establishment of child support orders. Just to highlight on our the next line item, you see the $214,000 there. That is a pilot we had. We had two vendors, Benchmark Human Services. They focused on regions 1 and 2, and then we also had Georgia Hope, who specialized down in region 12, which is the coastal. So that's your Brunswick, Chatham, and Glenn County. And so currently, as of January of 2024, they have served over 158 clients in regions 1 and 2, roughly 24, and in region 12, they've serviced 134. Going down to another highlight, you see the line item for $4.6 million. Again, that's an additional $3,000 for our frontline child welfare services staff, also known as social services workers. And the starting salaries for a social worker with a bachelor's degree is $42,388, and a social worker with a master's degree, their starting salary is $45,927. So we're thankful for them receiving this increase. Turning to the next slide, on slide 4. You see here the House has added $1 million to increase funds for our court-appointed special advocates, also known as CASA, to continue to enhance their statewide capacity. And then next, the House entry, they recommended $1.5 million for the child advocacy centers to expand mental health services and forensic interviewing for children who have experienced abuse, neglect, exploitation, and trafficking. The next entry there, you see a reduction of the $2.6 million. That was part of our 1% reduction ask. This was due to office consolidation, where our agency moved from 2 Peachtree, where we occupied 17 floors, and we moved to 47 Trinity, where we now occupy 2 floors. And we have a total of roughly 233 offices across the state. So. And for those that typically normally would commute into downtown Atlanta, they can now utilize some of those local offices near their home. The next line item you see is a transfer out in Department Administration program, about $1.6 million. Then this is to match program expenditures to program purpose. So in admin, we're moving it to our Federal Eligibility Benefit Services program, also known as FEBS. And so this is our electronic benefit transfer program. And the total program is about $8.1 million. And we have, thus far through January of 2024, we have served over 669,000 clients, which equates to roughly $259,492,630. And if you put it to a family, it's roughly about $388 per family. The next house ad that you see an increase of $900,960, and this is to increase funds in our long-term care ombudsman program, also known as LTCO. And this is to address some retention needs for roughly 42 staff, along with adding 3 new ombudsman's representatives. On the next slide, slide 5. Addressing some of our core frontline staff within the agency. You see a $1.2 million increase for our in our elder abuse investigations and prevention program budget. And these are our frontline staff, also known as Adult Protective Services, or APS, as well as our public guardianship officers, also known as PGO. And this increase here will impact roughly 279 of our staff out of 350. The next line item, the House has added, you see an increase of $550,000, and this is for our non-Medicaid home community-based services. And so in fiscal year 2023, the average cost for those services, the annual average cost was $1,516. So with this additional $550,000, we could cover additional 362 slots. Currently, though, as of January 2024, we have roughly 14,427 clients that are waiting on the wait list, and that equates to over 19,000 worth of services, because we can have one client on the wait list that could be waiting for 2 or more services. So that's why typically the services are higher than the number of clients. The next line item, the 1.6, that's just the money coming in from the money that was taken out and admin. The $2 million that you see here, this is an increase for our labor and wage data verification contract. We have a contract with Equifax that do real-time data analysis on wage, and so it was a price hike, and so this is the state fund portion of that price hike to cover that. $630,000, you see that's about 23 county office staff that we'd like to hire. During the pandemic, we repurposed those cost savings from vacancies and invested in technologies. And so now we're looking to hire those 23 staff so that we can transition to move to 5 days a week in most offices. I mean, some of our offices currently, we're open Monday through Fridays, and that's roughly 50 offices. Some other counties or offices are stagnant where they're open 3 days a week, and some are open 2 days a week. And so what we're trying to do with these 23 additional staff, we'd like to get the phases of 2 and 3 to 5 days a week. The next, you see the big item here is another ad from the House. You see an $8.3 million increase. This is a provider rate increase of 3% for our child care institutions, our child care placing agencies, our foster care parents, and our relative caregivers. On the next slide, here you see the governor recommended, this was part of our 1% reduction. The governor recommended a $1 million reduction for one-time funding to bridge the education gap. And recently in the House, they recommended an increase of $2,660,000. The $134,618 here, this is to provide funds to establish an application and inspection process for qualified residential treatment, QRTPs, that Commissioner Carson spoke about earlier. And so the next line item, this is our attached entity, Safe Harbor for Sexually Exploited Children Fund Commission. The Commissioner Bro, she chairs this commission here, and the $4.7 million ask that you see here is to ensure that we have the full cost for the Gwinnett Commercial Sexual Exploitation Recovery Center, which was funded in House Bill 19. It is now called Grace's Place, which was named by First Lady Marty Kemp. Then the last item here, the $100,000, this is it was a House ask, and this is to increase funds for a psychiatric nurse to support youth survivors of exploitation and trafficking.
Thank
Concludes
you.
my changes.
Thank you, Deputy. Appreciate it. I have one question here,
Okay.
Senator Kirkpatrick.
Thank you very much. As you know, we had a study committee on foster care and adoption, and the increases for the caseworkers, the frontline caseworkers, is very important, along with the provider increases. I did have one question about the Shines program. I know we've been putting Band-Aids on that thing for quite some time, and I would imagine that you all are looking a little bit farther ahead to
Yes.
next year to try to replace the Shines system.
Yes, it's a long process. It's a process. We're trying to replace it. We got a quote currently. The total funds is roughly about $80 million, estimated at $80 million, with half of that, $40 million, being state funds. So,
All right, thank you very much. We appreciate it.
all right, thank you.
Okay. Georgia Vocational Rehab Agency Executive Director Chris Wells.
Just want to say thank you for the opportunity. I'm Executive Director Chris Wells for GVRA, and my CFO or Deputy Director is Ms. Mamta Patel. I'll try to be 3 minutes or less. Most of the information is in the back of your packet, but depending on which tracking document that you're looking at, House page 9 and 10 or the Senate bill, most of our recommendations are pretty straightforward. Outside of the statewide spreads, which you'll see in most of our programs, again, in that Senate tracking bill 49 through 50. But if you're looking at slide number 2 on the presentation itself, you'll see a summary of the recommendations. Again, most of our statewide spreads are throughout each program, equates to about 301,000. But again, the most notable changes that you'll see throughout our budget is on page 50, which is in our vocational rehabilitation program. You'll see on 205.6, we have 4 police officers that's on our residential program in Roosevelt, Warm Springs, and so that 3,000 is for those particular officers there. 205.7 or 28.23.7, you'll see a reduction in your expenses for 403. We were able to work closely with our federal partners to move a lot of the initiatives to our federal funds, and you'll see corresponding slides in your spare time later on in the presentation that can address some of those funding changes that we made. You'll see there on section 205.8 or 28.23.8 as well as 205.9. Those 2 recommendations are specifically for a 1% reduction. We closed a few offices as we continue to leverage our virtual environment, and so this gave us an opportunity to work very closely there to reduce some offices and associated expenses. If you look at the House bill in that section 28.23.10, you'll see 3 additional adds, one specifically for the increase in funds for new durable medical equipment and assistive technology. We have an agreement with FODAC to be able to provide some assistant work technology, and we believe that 57.5 helps to accommodate that and be able to serve individuals that are looking for some pre-voc rehab equipment, whether there's wheelchairs, whether they're walkers, so those individuals don't have to pay the $25 service fee. And you'll see here the yes item for utilizing existing funds to support services for blind and visually impaired. We've done a lot of outreach, and this specifically for our relationship with Georgia Radio rating services. We entered into an agreement for about $500,000, leveraging some federal funds to be able to assist and provide an alternative mode of communication for individuals that are interested in VR services. And again, you'll see a little bit more of that information later on in your packet. And then lastly, you'll see an increase from the House in the tune of $1.1 million. This is for, we believe, pre-voc rehab services that currently VR funding is not able to be used on. And so we would work closely to ensure that those funds are spent in accordance with the recommendation here. Outside of that, we do have $5 million in bond funds, and that goes towards our maintenance, improvement, and capital investments for our residential campus at Roosevelt Warm Springs. This concludes the presentation for GVRA.
Thank you. Appreciate that, Director Wells. Any questions at all? I don't see any questions. Appreciate your presentation.
All right, thank you.
Department of Public Health, Dr. Toomey.
Thank you, everyone. It's good to be here, and I don't take it personally. I've been last in every single house since
Saving
I've been
the
here.
best for last. There we go.
No, I think it's just because you have so much confidence in the work public health is doing. And for that, I'm
There we
very
go.
grateful. I will, as instructed, I'm going to go very quickly through, particularly, thank you, through this, but I think just hitting the highlights. Obviously, the statewide changes, as every other department has talked about, the difference is that our changes also provide increases to Board of Health employees. They are not state employees, but they are Board of Health employees, but they get many of the same benefits. And those additional fundings extend to them as well. And I think that's important because it reflects the unusual structure of our department and our interface with the county boards of health. The governor recommendation and House recommendations took our reductions that will not affect any of our activities, including in the lead program. We had used the additional funds, got our equipment, and we're ready to go. And telehealth equipment is not going to in any way affect the implementation of telehealth, but was due to the fact that we did a very thorough inventory. We have plenty of equipment now to use, and particularly as we're looking forward to doing additional work both in the perinatal area as well as in HIV in rural Georgia. So looking at the program budget, many of these look exactly the same as in the supplemental budget. The Clayton District Health Director on state funds, the warehouse, the epidemiology increases for both for PDMP as well as for the low THC program. That's fully funded then for one position to help increase the quality of our data through the low THC program. And then finally, the capital projects, again, these probably look familiar to you. This is both in Waycross, the Albany district offices, and the Waycross Public Health Building. Generators and some other chillers were very old, some of them as old as the building itself. And so these need to be replaced because these, particularly in rural Georgia, these buildings house vaccines for vaccinations, and it's essential that these be kept at a constant temperature. Not to mention the fact that we can just completely shut down a whole health department if there isn't power and adequate supply. So anyways, moving on to the changes, which really are very exciting from the House side. The first is an addition for the sickle cell. And this is something that, interestingly, that Dr. Burke, Russell Carlson, and I had just talked about. How can we do more in the sickle cell area? But these will provide mobile care by a visiting hematologist into rural Georgia, which is really a good thing. I mean, many of these kids don't have access or easy access, and if they have to drive 2 hours, to get that sickle cell care, they may not get it at all, or they do episodically. So we were pleased to see that, as well as an increase in funds for breast cancer screening services, and it provides a whole array of potential options, including support services. One of the main issues that I've seen with our breast and cervical cancer program is that we have the highest rates of cancer killers in Georgia is breast cancer. It disproportionately affects African American women, but part of that is just access to care. There may not be easy access to mammography, and once identified, easy access to follow-up. So we're looking at options for how we can provide transport to support women getting to that care once getting that screening and then identified where they can get that care. And we have that through the program, and this will be I think an extremely important budget addition. The Poison Center is well known. This is an addition to the an addition of $358,000+. This is a standing contract. I think that the only one on the panel may remember is that I started years ago, and this is just to allow them to continue this work with additional staff as the needs have increased and they're getting increasing calls, not surprisingly. And last but not least, I wanted to talk about some of the new things that were also put in the budget, for which I'm very pleased. Many of you know that we were funded to initiate a home visiting pilot last year. It's gone very well, even though we just started out in October getting people on board. Chairman Hickman's district is being served, as well as in North Georgia. And with the additional funding, we're going to get to bring us to a total of $3.4 million added to last year's budget. So it's an additional million plus 1.7 million for a total of 3.4 million for the program. We will be able to expand to Senator Watson's district, LaGrange, Columbus, as well as Albany, which is an area that we've identified as being in need because of high-risk moms and babies. And we're very pleased about this. I think this is, to me, the most important maternal mortality and infant mortality prevention activities we have, because we identify social, behavioral, mental health issues, treatment issues, medical issues. And to use the words that Commissioner Carlson used, it's choreographed. I never thought about that. It really is, because we've worked across all the agencies, we've worked across multiple providers, and the home visitors from the communities can actually ensure that those connections occur, can help them get transport, and ensure that follow-up occurs. It's not just a drop-off and good luck to you. And it's very, very exciting, and I think represents a cross-agency collaboration like I've never enjoyed in this role, and very much looking forward and grateful for those additions. We also received that additional funding, as the governor recommended, for newborn screening. Two additional disorders have been approved by our committee, and then approved and carried out in the budget. Remember, this is budget neutral because there will be an increase in fees. So although it looks like it's going to be almost $1 million, it will actually be budget neutral ultimately because of the fee increase for the testing at the hospital site. And last but not least, one of the things that I've been most concerned about is our increase in congenital syphilis. As syphilis in women has doubled, congenital cases have quadrupled. And given that, we felt that one of the things that were missing with our programmatic activities was a case manager that could actually follow when we get a woman with syphilis to ensure that she gets that treatment. Is she pregnant? At what stage of pregnancy? How can we fill those gaps and identify those holes? So I think this is a much needed, and we're very, very grateful to see that in the House budget. And I'll be happy to answer any questions. I'll be happy to come by and see you in your offices. Happy to give you a map, because these counties are always hard for me to remember for the home visiting, and anything else that you have questions about. So thank you very, very much.
Senator Allrock.
Commissioner, appreciate your work and leadership, as always. On the infant and child essential health treatment, I know that you started at a very modest number of counties initially, and it's grown, maybe not exponentially, but it's in a growth trend. What exactly trace for us the counties and the number. I don't mean by name, but the numbers.
Originally, this will add 20 counties, and I think initially we had 21, is that correct? Yeah, 21. So this will go up over 40 counties. So this is really extraordinary, I think, because it will allow us to expand into those other high-risk areas that we had identified. And many individuals, including the perinatal centers and others, that say, why can't you come into our county? We have a problem. And we've seen the uptake that is so critical. And many women we're visiting didn't know they were eligible for WIC. They didn't know they were eligible for SNAP. Just basic services we can get them hooked into, as well as we've been working with Commissioner Tanner and making sure that they have access to behavioral health services. And as I'm talking about this, how could I have forgotten? I skipped over, I'm surprised you didn't kick me, that there was an addition for Babies Can't Wait providers. This is something that was a new addition. It was not in our governor's request. But I think it's recognizing that that's such an important part of our care for infants 0 to 3, and particularly around speech and learning, and also developmental disabilities. So we were really pleased to see that, and a reciprocal increase on Commissioner Carlson's side. So.
And I would just add that it's heartening to see a pilot grow and not just stay at that early pilot level.
And especially grow into counties that so desperately need it.
Exactly.
Yeah, thank you.
Appreciate
that. Senator Watson.
Thank you, Mr. Chairman. I know we passed Senate Bill 495 recently dealing with the THC oil registration cards, and I know there's going to be some costs that your department's going to incur with that. Could you share those with us?
Sure. No, absolutely. And again, your guidance on this is much appreciated. Probably the startup is going to be about $1 million, just getting those e-cards set up and to have the system in place to be able to ship the cards. Because I was surprised myself when we costed out the actual shipping to FedEx cards, if that was the way we'd be going, at least with some individuals. And then the system, e-card system itself, would be about $600,000 a year to maintain it. And again, we stand ready to do what you would like us to do. We just want to make sure that we have the resources to do so, and also recognize that there may be some people who may not be able to navigate an e-system. I'm surprised actually that Director Jones didn't say, and I've heard the most complaints from Dr. Toomey, because I always get complaints about registration, and I'm one of his constituents, as is Dr. Kirkpatrick and Dr. Watson. So I just realized that even people with many degrees can't always navigate systems, and the folks on this program may not be able to. I'm just speaking for myself now. And anyways, enough said, yeah.
Thank you. All right. Anything else? All right, we appreciate it. Thank you, Dr. Toomey.
No, thank you, sir, and nice to see you all.
Okay.
Thank you. Thank you.
All right, Trauma Care Network, Executive Director Elizabeth Atkins.
She might have a substitute.
All right.
Another substitute.
Yeah.
I believe you have your blue packets before you. Where are we? Yeah. All right, good morning. Thank you. It's an honor to sit before you today. As you can see, I am not Director Elizabeth Atkins. Both Director Atkins and Dr. Ashley are in Chicago at the American College of Surgeons Committee on Trauma, and they are sharing some of the great work that you'll see in these slides that we have done here in Georgia. So I appreciate all the support that you've given us in the past. We appreciate the funding provided by the governor. And I will mention that we were just notified yesterday that the House had put in an additional $2.5 million into their budget recommendations to support the initiation of our trauma system stabilization plan. So unlike the previous presenters that you've had before. Oh, I should tell you who I am, first of all, shouldn't I? My name is Dr. Regina Medeiros. I apologize. I am the chair of the Finance and Budget Committee for the Georgia Trauma Commission, and sitting next to me here is Katie Hamilton. She is our CFO. All right. So a little bit different than what you've seen. You've gone through a lot of the numbers today with the other divisions. They've looked at the budget line items. We don't have a lot of line item budgets, but I do want to talk a little bit about what we've done over the past years with the funding that we've received, share with you some of the successes that we've had, and then bring forth to a fairly large ask. But the slides will go over for you why we're coming before you with this large ask, so you can see exactly what the dollars will be used for in support of the Georgia citizens. So over the past 16 years, we've been able to increase the number of trauma centers by doubling that number and improving the access to care from, I'm sorry, resulting in a 30% increase in access to care for the most severely injured patients, decreasing mortality, which I'll show you in the next few slides, and improving patient outcomes. It's significant because we didn't have that level of access in the past. If you look at your next slide, you'll see back in 2007, when the commission first started, there was a lot of white on the map. The map shows all the areas within the state of Georgia that didn't have access to trauma care within 1 hour. That's access to highly trained, skilled providers, as well as the necessary resources to potentially make the difference between life and death. But now in 2023, you can see that the white on this slide is a lot less, although there's still some areas of gaps, particularly in the most rural parts of Georgia. We know that survival is better at a designated trauma center. There's lots of data out there that shows that, and we'll talk about why that is and what cost is associated with that in just a few minutes. But early on in 2003, there was only 64% of patients who were being treated at trauma centers. However, due to the expansion that we've had, we now have 93% of severely injured patients being treated at trauma centers, meaning that they have a better chance of survival, a better chance of returning to their homes and families, and more importantly, from a fiscal standpoint, returning to their tax-paying jobs. And what has the impact been of the Georgia Trauma Commission? Well, the commission was first formed due to a battle cry because back in 2003, Georgia moved from 16% worse in mortality rate than the national average, and that was unacceptable. So the commission was formed. We continued to develop, we continued to grow, we've expanded the trauma system, and now you can see in 2019 and 2020, we are 6% better than the national average. That equates to about 1,803 lives saved in 2020 alone. And also, it's important to note that our surrounding states, as you can see in the bottom of your slide, we are outperforming them. The gap is even wider. So we've been pretty successful, I think you can say. But let's switch gears for a minute, because I talked about access to care, improving access to care, developing the trauma system, increasing the number of trauma centers across the state of Georgia, but that comes at a price. And one of the costs is what we refer to as readiness cost. And readiness cost is basically a cost incurred by hospitals as a fixed cost. It's infrastructure, as well as personnel who are available 24/7, 365 days a year, whether one patient comes through the door or 1,000 patients come through the door. And what's most important to share with you is that this cost is incurred by hospitals and is non-reimbursable by insurance. There's no procedures that are going on while the physicians, the OR, the lab, the blood bank, the nurses, the ICU are waiting. So they sit there, the hospital pays call pay, they pay coverage for surgical specialties, the thoracic surgeon that may have to come in if you have an injury to your aorta, all kinds of specialists available 24/7. But how do we know what these readiness costs are? Well, we did engage in some studies to look at how do we know that the money we're providing to hospitals is the money they need, or are we providing too much, too little? Are we providing just enough? Because we don't want to just be handing out money for the sake of handing out money. And so in 2016, we embarked on a project to identify readiness costs for level 1 and 2 trauma centers. And then in 2019, we replicated that to look at the cost for level 3 and 4 centers. And this process was so successful that it's also being replicated in other states, and the methodology that we've used is being utilized in other states and has been validated because they too want to know what is the readiness cost to have trauma centers across their states. So on average, you can see on your slide that it's about $10 million for readiness annually for a level 1, $4.9 or $5 million for a level 2, $1.7 million for level 3, and about $81,000 to maintain annually a level 4 trauma center. Now, the cost has increased over time, as you can see, but unfortunately, the funding received has remained relatively flat. At the beginning, in 2009, was when we got that large $60 million increase, which is about 50% of readiness at that time. But as you saw in that first slide, there were very much fewer trauma centers, and we've increased, doubled the number of centers that we've had. So our costs have gone up, but the amount of funding we have received has stayed relatively flat. It equates to about 6 cents on the dollar for readiness that we're providing to hospitals right now. It was 7 cents on the dollar, but all centers who participated in the system felt all should receive some of the funds. Historically, there were some centers that were designated that were performing trauma centers, that were providing care, that were not part of the funding formula, but the centers within the funding formula wanted them to receive some funds as well, so we took a reduction so that those other participating hospitals could receive funds.
I'm going to open this up for questions if anybody has any questions at all. We've got, this presentation.
You've seen it? Hey, that's okay with me. Yeah, if you guys have
I've
any
seen
questions.
I've seen the 60-minute version. I've seen the 15-minute version, and so.
So you know the return on investment.
Yeah,
you know what
I
we're
do.
asking, 61
do.
million, and I will happy to entertain any questions that you
I
have.
do. The one question I have is the fireworks. How much money are you getting from the constitutionally?
1.7.
And that's on average. That's pretty. That's been an average.
Yes,
what we've been
that's been
getting about
average.
1.7. Gotcha. Okay. Senator, all right.
Thank you, Mr. Chair. I haven't seen quite as many of those presentations as you have, but so the 61 million. The slide 16 shows how that would be.
Yeah, let me go to the
distributed.
we enhanced. If you look up on the screen there, you'll be able to see what coverage area would be. It's the yellow. That's where we have current trauma centers in the pipeline that would be coming on as designated and ACS verified trauma centers. So you can see the difference in the coverage and expansion.
And how do we compare with I've been told South Carolina has 4 level 1 trauma centers in that city.
In Charleston?
Yes.
That could be true. I don't know how many level 1 trauma centers they have.
Just comparing ourselves with the surrounding states was what I was interested in, and
Sure.
Charleston leapt out at me.
If you look at the maps that you have in your handout, the dots are color-coded, so you can see the distribution by level of centers across our state. So you particularly talked about Charleston, that you said had 4 just in Charleston
that's what
alone.
I've been told.
So if you look for Atlanta, which is where we are now, which is
yeah,
the
that's
highest
where-
population, we have 1.
Yeah, I understand that, but we
Yeah.
live in that reality.
Yes.
Yes, we are.
Alrighty.
And the where you would put this, is this what augmenting centers that are already up or launching new ones? This 61 million for the proposed 50% of readiness total.
So we both. One thing we want to do is stabilize the existing centers so we don't have centers dropping out of the system because the cost has continued to increase. And we want to provide startup grants for those centers in the pipeline who want to become trauma centers, particularly in the rural areas where you see we still have underserved areas.
Exactly.
Yes.
Exactly. Well, I applaud your looking forward and and seeking more funding for this, because we have a ways to go. We've come a long way, but Got a ways to go. Thank you.
Well, thank you. We appreciate all the funding we've received so far, so we're very grateful for that, and hopefully we'll see more.
Thank you.
Thank you.
Thank you.
And lastly, Georgia Board Healthcare Workforce Executive Director Chet Basine.
Good morning. Thank you for having me. I will be brief. I know we might be a little bit short on time, but I'm always available to come to any of your offices for any follow-up questions. I just want to state that. So Chet Basine, Executive Director at Georgia Board of Healthcare Workforce. The presentation in front of you has the governor's recommendations. I do have the House with some notes. So if there are questions from their release, I will do my best to answer that for you. And if not, I can always follow up. What you will see on the second page of the slide deck that was provided, those are all statewide adjustments. So I just want to echo everyone who's been up here before and say thank you for the consideration that's going to come on the pay increases. The staff is very excited about that, but that would be line item 94.1. And I will go all the way through, and I guess 94.7 is the only one that has just to utilize existing funds for healthcare specialty surveys. That's just I wanted to notate that, especially Chair Watson, that's what we're doing with the neurology endeavors that we've been speaking about. So I'm going to move on to graduate medical education. 95.1 has 79 slots for additional GME coming in at $1,494,596, and then you'll see 95.2. It's just the standard FMAP reduction that everybody else has had. So ours totals to a reduction of 62,870. That's all that is. I'm going to proceed on to the Mercer School of Medicine operating grant in line item 96.1. That's just part of their 7-year program and endeavor in Columbus for that new campus. It is pretty. That's $850,055 to support them. And then Morehouse School of Medicine actually had no adjustments, so I'll skip over them. Physicians for rural areas had nothing, and undergraduate medical education had nothing. So that is our budget presentation from the governor's recommendations. I do have, like I said, some notes from the House if that's of interest, and glad to answer any questions I can.
Any questions from anybody? All right. Senator Sam Watson.
Thank you, Mr. Chairman. Could you speak to some of the House ads at 1712.6 and 1712.7?
Yes, Senator Watson. Looks like 1712.6, I believe, is if we're referring to the one-time startup funds for an OB-GYN service expansion. I'm told that's for Colquitt Hospital. Colquitt. I'm sorry. That's my Chicago coming out where I'm from.
There's some matching funds with that as well. Are you aware?
I was what I was shared with me was there was some federal funds. I don't have the intricacies, but I'm glad to go and research that.
Okay, thank you.
Sure.
And the next one, the
1712.7. Sorry about that. Provide one-time startup funds for 2 internal medicine residency programs. Excuse me. That's Archbold. And I'm waiting on confirmation, but I believe the second hospital is South Georgia Health System. And then the last one is 1712.8. That's the removal of the $150,000 for Southern Regional Medical Center. That's because they are now participating in the GME capitation funds. And the belief, what was shared with me, is that they would draw more funds through that because it goes through the federal matching as opposed to getting the $150,000 from the state.
Thank you.
Yes.
Do you have any insight into the 17.13.2?
I unfortunately, Senator Watson, at this point, that's all I know. What's 1713.2, the one-time funds for expansion to Valdosta campus. That's all I know of at this point. I don't know what else is entailed there. I'm sorry.
Okay. All right, we just follow up on that. I appreciate that. I don't, no more questions. That's good. Thank you. We'll follow up on those. Appreciate that.
Thank you. Have a good day.
And that concludes our meeting today. Thank you. We started off with a full room, and now we're whittled it down, haven't we? Okay. All right. Thank you. Okay. Meeting adjourned.